Now we discuss about the classification of the cataract and its definition. What is the cataract? Cataract is Latin means the waterfall. In the 70s, the most of the people were thinking about that it is like the waterfall from the eye. In the definition, we should know more about it is the opacification and degeneration of the lens fibers, which is already formed. The formation of the aberrant lens fibers or deposition of other materials in their place. Okay, any opacification of the lens and degeneration of the lens fibers. Okay, these are the main points of the definition of the cataract. You can see here the cataract is the opacity of normal clear lens. Okay, this is the opacity of the lens. This is normal lens. This is the cataract lens. You can see here the more difference as the clouding of the lens. In the center, you see some white patches like that. These are the lens fibers are degenerated, and you can see here the healthy eye. You can see here the healthy eye, and this is a clear lens. You can see here the normal eye lens, but here is the cataract lens, which is so opacified that one cannot view anything. That's why it appears something white in colors, and you can see has a normal lens which is transparent and biconvex. But the cataract lens is not a like a fully transparent, and not a it's a biconvex, little biconvex, but it is not a transparent. That's why we can't see clear. Here you can see about the cataract lens. Now, what are the etiology? Here are the eye injury, sun exposure, smoking, hypertension, kidney disorders, diabetes, long-term use of steroids, and the toxic substances and hereditary. There are some etiologies. And pathogenesis, which involve the degeneration of lens fibers, opacification, deposition of further material, as well abnormality of the lens protein, and disorganization of the fibers. I have something detail about pathogenesis I have shown to you later. There are some symptoms. The blurred vision is the main symptom of the cataract. The need for frequent changes in your eye glasses and contacts. Eye glasses are the contacts. Okay. Trouble in driving at night, which means glare. Something like a clouding like that, and sensitivity to bright light. You cannot to see the shining light like a sun, because they have some you have some sensitivity to bright light. The change in color vision, like yellow, orange, red appear brighter, and white appears dull. That's the main symptom of the color symptom of the cataract. The polyopia and monocular diplopia and colored halos. These are some symptoms of the cataract. You can see here the blurred vision due to scattering of the light on the retina. You can see here the scattering in the vitreous hemisphere. You can see here the scattering of the light, but in normal eye you can see has the not scattered. The image is very quality image, a very clear image, but in another cataract you cannot see the clear image because the light is scattered due to the denatured of the or opacification of the light of the lens. You can see here the vision, the blurred vision. At the vision you can see the blurred because the light is the from the refractive lens is not clearly reaching the retina, but it is in the form of scattered. That's why the vision is blurred. Has some glare view, the trouble driving at the night. You cannot see some clear view at the night because it have clear view due to lens opacification, or we can say due to denatured lens fibers. Here you see the change in color, the color vision. You can see here it's green in the cataract but the blue in the normal eye. This is also main difference and the main symptom and main finding of the cataract. And the classification of the cataract is based on the morphology of and age of onset and maturity and etiology. And morphological, the capsular cataract, it may be anterior or the posterior. And subcapsular cataract, it may be anterior or the posterior. And nuclear cataract and cortical cataract. On the basis and laminar and zonal cataract as well and sutural cataract as well, you can see has the anterior cataract and the posterior cataract. There's a posterior cataract and the anterior cataract. You can see it's the upwards EC. It means the you can see here about the cataract, nuclear cataract, okay, and posterior cataract. These are some types of the cataract on the basis of the morphological. And posterior subcapsular cataract has a cortical cataract, nuclear cataract, and mature cataract. Okay. On the age of onset is defined and classified as a congenital, infantile, juvenile, the presenile, and senile cataract. The congenital cataract you can see here. These all can be discussed later. They have only introduction. And the infantile and juvenile cataract you can see here. And the maturity, intermittent cataract, immature cataract, mature cataract, hypermature cataract, and Morgan cataract. Mature and immature cataract you can see here. Immature cataract, partially cataract, mature cataract, completely vision loss, or you can say completely opacification of the lens. These all can be discussed later. Immature you can see here is mature fully, and is immature partially. On the basis of the etiological, you can see as a traumatic cataract and a metabolic cataract, toxic cataract, complicated cataract, intrauterine cataract, hereditary cataract, radiational cataract, and electric cataract. These are some meteorological classification of the cataract. And cataract also associated with the skin diseases like atopic dermatitis is the main skin disorder. And cataract associated with also osseous diseases called parathyroid tetany. And cataract with miscellaneous diseases like dystrophia, myotonica, Alport syndrome, Down syndrome. After cataract, some subjective classification as well. The grade 0 it means clear lens. After the grade 1, the swollen fibers and subcapsular opacities. The grade 2, the nuclear cataract and visible lens fibers. At the grade 3, the strong nuclear cataract with perinuclear area opacity. The grade 4 is the totally opacity. It means the major cataract as well. You can see here the grade 0. We have talked about the grade 0. It means clear lens. It's a clear lens. In the grade 1, the swollen fiber and subcapsular opacities. The swollen fibers. Okay, and the grade 2, the nuclear cataract and visible lens fibers. Here you can see the nuclear. Only nucleus of the lens is involved in grade 2. And grade 3, you can see a strong nuclear cataract with the perinuclear area opacity.
You can see here the systemic diseases and some the AIDS, which may be the main pathogenesis of the cataract, and the greater sinus can make massages. Now discuss about the pathogenesis of the cataract. In the pathogenesis, you can see here the systemic diseases and AIDS. The AIDS is the most common cause of the cataract. On the basis of the systemic disease, you can see diabetes mellitus, which is the most common systemic disease of the cataract, and these and the others are the myotonic dystrophy, atopic dermatitis, BCG, relapsing polyposis, You can see here the fusion is largest in a gap which is gel-like material. The glucose is increased. Okay? Increase the glucose. Then increase the glucose. That may cause the secondary osmotic overhydration of the lens. Secondary osmotic overhydration of the lens. Which means the secondary osmotic overhydration of the lens increased. That may cause the some opacification of the lens. Now you can see here in the age-related, this is the most common cause of the cataract. UV light and some radiation and toxins. These may cause denaturation and abnormal structural changes to the lens and crystalline protein. These increase density and stiffening and pigmentation of the lens material. Okay? This may cause opacification of the lens material. Which may cause the cataract positive. Which is called cataract. Okay? After cataract, what happens? Now it's about here. What happens after cataract? The loss of transparency of the natural lens. Okay? You can't view anything. You can't see anything. You can see anything but not clear. It will not be clear. Okay? The lens will not be transparent. And after that, the hardening of the center lens nucleus as well. It means decreased contrast sensitivity. Hardening of the center lens nucleus have we start about the new symptoms, clinical symptoms of the, you can see here, we have no more about the symptoms of the cataract. If the lens or transparency of natural lens decrease, it's nervian, so nervian. If the hardening of the center lens nucleus, it may cause the decreased contrast sensitivity.
After that, the scattering of the light. Okay, but here you can see hardening of central lens nucleus. They produce increased refractive power and the nearsightedness, means myopia. Okay, it also may cause the myopia and the decreased contrast sensitivity. After that, scattering of light may cause glare, halos around the light. May cause poor light, poor night time driving. It cannot difficult to poor night time driving. After the scattering of the light, you can see here hyper mature enlarged cataract. Okay. Then these iris trabecular mature contact and secondary angle glare glaucoma is also occurred in the cataract. And trauma or blunt or penetrating eye injury can also cause the cataract or opacification of the cataract. You can see here the equatorial stretching and damaging of the lens capsule. Okay, or previous ocular surgery or congenital cataract is also cause cataract, or we can see opacification. That this is called the cataract. If you say opacification of the lens of crystalline lens, okay, opacification of the crystalline lens is called the cataract. This all about the cataract. Is here you can see understand more about the pathogenesis and clinical findings of the cataract. Thank you from here. Goodbye.